Hello and welcome. My name is Chris Shelton, coming to you from San Jose, California, the heart of Silicon Valley, with your DIY home remedies for health, happiness, and healing transformation. Today what I thought I'd talk about is something that affects millions of people around the world, which is back problems. And when we talk about back problems, there's all different types of back problems, but it all comes back down to the same root, and I'm going to discuss that. So what we're going to be discussing today is drop leg syndrome, sciatica, lumbar stenosis, blown or ruptured L4, L5 discs, and SI joint pain or hip pain. So what is the root cause when we look at back problems? Some experts believe that 80% of the population will experience back pain at some point in their life. And unfortunately, over 264 million work hours were lost last year due to people having to take time off of work because of back issues. Back in the 70s, when I was growing up, the only people that really got back problems were people that were overweight and or couch potatoes. But nowadays it seems like one of the biggest diseases that I see actually in my clinical practice is back issues. And I can't figure out why it is that I could have the couch potato or I could have the elite athlete, and it does not discriminate between young or old. Nowadays it does not discriminate whether you're an athlete or not. So I was troubled as to the reason why so many people around the world, especially when I was flying back from Chicago one time after seeing these young group of guys that had a chance to play for the NBA, why they were being diagnosed with lumbar stenosis and they were being told that they could never play ball again. I mean, they're young, they're healthy. It didn't make sense to me. And then finally, I finally recognized what was going on. Our sympathetic nervous system, which is the part of the nervous system which is responsible for the fight or flight mechanisms inside our body, you know, thousands of years ago, or even hundreds of years ago, you know, when that nervous system would be triggered was only in a time of real distress, like your house was on fire, being chased by a bear, etc. But nowadays what I realize is that sympathetic nervous system does not know the difference between being chased by a bear, your house being on fire, running late for an appointment, being stressed out about paying bills, somebody cutting you off in traffic. You know, so what's happening is that the sympathetic nervous system, and especially in our society where things are speeding up and going faster and faster and faster, now the sympathetic nervous system does not shut off. And as a result of that, guess what? It gets stuck in our lower lumbar. Well, what controls that lower lumbar is two things. Number one, stress, which affects your liver and your gallbladder. Two, fear or shock to the system, burning the candles at both ends, not getting enough sleep, affecting the kidneys. But the muscle that actually holds up or supports the spine is called the psoas muscle. And you look this up, it's spelled P-S-O-A-S. And this muscle is about the size of your fist, and it's deep inside your body. And it attaches to the inner part of the femur here, and what happens is it comes up, it wraps around here to the lower lumbar, all the way up to your thoracic spine. So all of this here comes back down to this psoas muscle. And so actually in clinic, in order to fix back problems, what we do is we actually treat it in the front or in the groin, and also on the gallbladder meridian. So this muscle here is your protection muscle. There's actually part of the muscle too that connects to the diaphragm, so it influences and controls the diaphragm. There's another part of the muscle that where there's small fibers which actually help to hold the organs, the internal organs in place. So this muscle is major, and you can't adjust the spine without loosening up the psoas. I'm not trying to step on any toes out there, but I see thousands of people each year, and back problems are probably one of the easiest things for me to fix. Whether it's sciatica, lumbar stenosis, drop leg syndrome, they're pretty simple to fix if you understand the etiology behind what is going on. You have to address the psoas muscle, because if you do an adjustment and the psoas muscle is not addressed, then the problem is that guess what? That muscle is attached to the spine on both sides, and then what will happen is that those adjustments will go out of place, because whatever side is tighter is going to actually pull those vertebrae out of place, and then what creates there is an impingement of the disc, which then creates an impingement of the nerve, which then creates the pain. Another problem is a lot of people are going out for steroid injections. Sometimes they'll get in there, they'll hit it, and they'll be able to numb the pain for a few months or something. Other times it's hit or miss, but the problem with that is that it does not fix the root problem. So lumbar stenosis, a stenosis is anytime there's an opening that closes. So for example, you could have a stenosis of the artery walls, where the artery walls actually close up. So a stenosis in the spine is when you have the nerves that come out of the spinal canal, and then that opening, because that psoas muscle, once again, is so tight that it's pulling on the vertebra, both vertebra, and then what will happen is that it'll actually will close that opening of that spinal canal, which that nerve comes down. So if you have your lower lumbar fused, the problem is that if you have the lower lumbar fused, and you haven't fixed the psoas muscle, then unfortunately it's going to show up somewhere else inside your body, whether it's hip, SI joint problems, sciatica, is going to show up somewhere else. So really getting to the root of the psoas and being able to understand its influence on the body. And the other thing about the psoas too is that this is your protection muscle. If you think about it, this muscle is so big that if somebody was beating or attacking you, the first thing you do is you actually curl up into a ball like that. Well, that's because that psoas muscle allows you to do that. So in other words, if you have back pain, you see somebody with back pain, they walk bent over like this, yes, because their back hurts, but the reason why their back, or the reason why they're actually walking like this, is because this darn psoas is so tight. So what we do is we do what is known as a psoas stretch. Here at Morning Crane, we do it a little bit differently to get a better effect. And also what we do is we actually work on the gallbladder meridian here in the groin. So what can we do? What other things can we do in order to help to prevent or to understand or to reverse the side effects of back pain? Well, one of the things that we could do is we look at our stress. And like I said earlier, back problems are relatively easy to fix. The only time I've seen where I have a problem of fixing a back issue is when I have somebody who has a lot of resentment towards a male figure, and that could be a dominant father, a husband, a dominant woman that has a lot of yang qualities. So somebody that has a lot of this yang qualities, the male traits that was very dominant, and there's a lot of resentment held on to by the person, and they haven't let it go or learned how to process it, that's the only time that this area is difficult to fix. But otherwise, for the most part, it's really, really simple to fix. And so one of the things I recommend that my clients do, besides that psoas stretch, is I recommend that they do the liver move, because once again, our liver influences our nervous system. And I was talking about the sympathetic nervous system. Well, that's also influenced by the liver. And so when we have a lot of stress or we have a lot of angst, yes, sitting too much. So if you have a job where you're sitting too much, that also will create problems for your lower lumbar and tighten up the psoas. But the stress that's going on in your life, the anger, the frustration, the resentment that's going on. You know, when I see people in clinic and they say, oh yeah, my back started acting up, I started getting the sciatic nerve pain again, I then say to them, well, what was going on right before that happened? Oh, well, we just came out of the holidays, Thanksgiving was a mess, and you know, so there's all kinds of things. So always look at what's going on in your environment, because your body is going to tell you. But definitely there's a connection back to the stress that's going on to your life. So a very simple move that you could do is actually the liver move. And what we're going to do is we're going to hold a ball, and then what's going to happen is that we're going to pull one arm back, press one arm forward, and I'm going to imagine a green cloud filling up into the liver and gallbladder on the right side of the body. And I'm going to make this into a mindfulness practice, because I'm going to focus on that person who took my parking spot, or that family member that said passive aggressive things, or that coworker, or whoever it is that made you angry or resentful. You're going to focus on that, on the circumstance, whatever it is. As you inhale, you're going to imagine a green cloud filling up into the right side of the body. Then as you exhale, you're going to imagine that leaving like a dark cloud, going several feet away from the body and deep into the ground. And so what we're bringing forth here, when we let go of the anger and the resentment, the frustration, the stress, we're bringing forth the positive virtue of kindness and acceptance. Mainly acceptance that you can't change other people. All you can do is change yourself and change your perceptions of how things affect you. So pressing here. A little blustery day here in San Jose, California. Wind chimes blowing in the background. Okay, so from here, imagine that green cloud filling up, and then I'm going to pull that energy back into the liver, pressing down, and then pulling down the heavens. You can do 3 times. Right now I'm just going to do 1. Okay, So that's a great exercise to help to get rid of the stagnation inside the body, which then affects the liver blood, which then affects the nervous system, which then actually gets rooted here in this psoas muscle. Also, people with PTSD, anybody with PTSD, guess what? This is where it gets stored too, because once again, this is your protection muscle. Okay, so we have the liver move. The next thing we could do is actually the kidney healing sound. Place my hands on the kidneys. Now you could do this from a seated or standing position. And I'm going to inhale, imagine a blue cloud filling up into these kidneys, and the kidneys are located right opposite the belly button on the spine. And I'm going to inhale, making the foo sound, so fear and shock. If you know you're burning the candles at both ends, not getting enough sleep, maybe you're too stressed out because of the holidays right now, trying to fulfill everybody else's expectations. Remember to fill your bucket first. You're going to inhale, and then exhale. And as I exhale, I'm going to imagine the fear or the shock leaving like a dark cloud, going several feet away from the body and deep into the ground. Inhaling. And inhaling. Okay, now if you're in public and you're feeling anything come up for you in particular fear or shock, or you feel that these kidneys are weak, or you feel that the lower lumbar is weak, you can actually do the sound underneath your breath. So inhaling. And just imagine that pain and or that fear or shock leaving, going away from the body and deep into the ground. The third and final thing I want to give here is actually Qigong wise is actually the Wuji posture. In our Wuji posture, what's going to happen is I'm actually elongating my lower lumbar. So instead of having this S-curved spine and sticking my butt out, I'm actually going to roll and tuck that butt underneath. I'm elongating the L4, L5 as I tuck that sacrum. I'm pulling up on the perineum, so I'm imagining like the perineum is the acupuncture point located between the sex glands, anal sphincter muscle. I'm going to slightly have the knees bent. And when I'm standing, if I'm just standing in line somewhere, let's say at the grocery store or whatnot, I could actually practice this by standing this way. I'm going to tuck the chin, which then presses up at the crown point, hollowing out the armpits. And this is a very relaxed position. And you're going to see that it will actually alleviate a lot of pressure off that lower spine. And in fact, if you look at most professional sports like hockey players, baseball players, tennis players, golfers, boxers, when they throw a punch, when they hit the club, hit the baseball or whatever, you could actually see that when they strike whatever it is that they're striking, they are actually standing in Wuji. Now they may not call it Wuji, but you see that that sacrum is tucked underneath. Why? Because this is actually where your power comes from. So we're practicing this Wuji posture, which we find in Tai Chi and Qigong, but also if you do other sports as well too, finding this Wuji posture and practicing it is essential also to not only to alleviate lower back pain, but also to help to increase more power for whatever sport it is that you're playing. One more thing that you could do that's not a Qigong practice, but you could actually take a tennis ball, and you take a tennis ball, and if there are certain points on your, let's say if you have SI joint problems, so let's say you have pain here, for example, what I'm going to do is I'm going to take a single tennis ball, I'm going to lay on the floor. It's better if you lay on a hard surface like linoleum or a hardwood surface as opposed to on the carpet. A lot of times in PT, what they'll do is they'll tell you to take a lacrosse ball or a tennis ball and lean against the wall. And that does it okay, but to me it doesn't get enough pressure. But what you're going to do is you're going to find these tender points, lay on this tennis ball, and you're going to hit different points. Like here's your gallbladder 30 points. Those are also where the head of the femur comes in here. So you can lay on those points, or right here, bladder 54, bladder 34. So these bladder points right here, you'll find them when you lay on the tennis ball. So if you do have SI joint pain, which is also triggered from the psoas muscle, the other thing you could do too is you could actually lay on those tennis balls, and you want to breathe into it, because if you put your full body weight onto the tennis balls, it's going to be like somebody's actually sticking their elbows in your glutes, and it's going to be uncomfortable at first, but if you breathe through it, allow it to dissipate and relax, you actually will help to loosen up the secondary muscles that actually influence the SI joint as well as the lower lumbar. So there you have it. We talked about something that affects millions of people around the world, which is back problems. And like I said, of all the diseases that I see in clinical practice, Back problems are probably one of the biggest things that we see, and once again, it does not discriminate between young or old, whether you're a couch potato or an athlete. It's something because of the stress that we have in our environment, triggering the sympathetic nervous system. So the types of things that we want to do is be able to calm down that sympathetic nervous system, making sure to stretch, so doing regular hamstring stretches and stuff. Later on, we will be making videos for the medical Qigong students out there of how we actually work on this in clinic. So wrapping up here on discussing lower lumbar problems, sciatica, SI joint problems, drop leg syndrome, as well as blown or ruptured disc. And the 3 remedies that I gave, well actually the 4 remedies I gave, number 1 is the liver move. So we have to work on that stress. How is that old anger or resentment or modern or recent resentments affecting our nervous system, which creates and gets stuck in this psoas. The second thing we gave is the healing sound for the kidneys, which is the healing sound of food to strengthen the kidneys, which influences the back and influences the spine. The other thing we talked about is the Wuji posture, and again, you can do the Wuji posture from a seated or standing position. And then the 4th thing I talked about is also sitting on those tennis balls and finding those what they call as ashi points, the tender points on the glutes, in order to help to alleviate and calm down the muscles that are triggered when the psoas is too tight, restricting the nerves in the spine. Click on the link below. Subscribe to this YouTube channel. Please share this information with your friends, especially this issue that we're talking about right now, which is back problems, because I guarantee you there's more than one person that you know in your life who does suffer or who has suffered from backaches. And if we could eliminate or help the society to understand the root cause of what triggers back problems and to eliminate surgeries, unnecessary surgeries, or those cortisone injections, I'm all out for that kind of stuff. So once again, here we are to empower you, giving you the tools necessary for you to be the best version of yourself that you could possibly be. Until next time, from San Jose, California, I'm Chris Shelton. I will chi you later.